My name is Lester Kivett, and I'm honored to be here today as we delve into a matter that I think transcends professional boundaries.
Thanks, Lester. And I'm Sanesh Albert. We're here to discuss the crucial question: should the Actuarial Society of South Africa actively participate in broad public policy analysis and debate? This is a question that touches upon the very essence of serving the public interest and a cornerstone of professions worldwide.
Indeed, Sanesh, and to provide us with the invaluable insights into this topic, we have two distinguished individuals, teams of thought with us today. Leading the team in favor of this motion is the formidable MULAUDZI in his capacity as the public interest actuary.
And opposing the motion, we have the ever so wise Simon Lowe leading the team against.
But, ladies and gentlemen, no debate is, of course, complete without a skilled and impartial moderator. So we are fortunate to have in person with us here this morning, joining us today as our moderator for this debate. Nalin Naidu is the head of Property 24, and of course, his experience and expertise will guide us through our conversation today, ensuring it remains informative, but just hearing some of the pre-battle words, keeping it fair here today. And throughout this debate, we, of course, invite you to participate, you, our audience, to actively participate by sharing your thoughts and questions online on the app. Of course, again, preference will be given to those who raise the hands here in audience. A microphone will be brought to you, but of course, virtual attendees can ask their questions online on our app.
So today you can expect in the debate, you can anticipate gaining a deeper appreciation of public interest work carried out by Assa. We'll also explore opportunities and challenges inherent in this mission, and we encourage you to join the conversation, making it a live engagement, please.
So remember, Nalin will be moderating the debate. He'll be incorporating some of your contributions. There will also be a poll that is also available on the app to determine who you believe to have won in this debate. So without much further ado, let the debate begin. Thank you all so much for being here. I now hand over to Nalin Naidu.
Thank you, everyone. Thanks for the introduction. I am privileged yet today to adjudicate this debate. I'm going to do a little bit of introduction to our session and then hand over to our two skilled speakers. Maybe just as context, I think the first question we must ask ourselves is, why are we actually introducing this debate context? So why are we having a debate this year in the convention? And I think what's become clear is that rigor and objectivity in how we analyze complex topics is important for us as actuaries. How we can deliver balanced views or hold balanced views, deal with conflicts of interest, deal with different views, deal with different paradigms. It's key for all of us here in how we approach our daily work. And a debate context is extremely useful for that. We then look at the SA situation or the South African situation. We heard from Jeremy Gardner this morning. Private-public partnerships are crucial to South Africa's success. But how are we able to actually contribute to this in a way that appropriately minimizes or manages the risks that we face as a profession? And then finally, the Actuarial Society situation itself. So we have a public interest strategy that's soon coming up for renewal. We are keen through this debate and the other debates to get a sense of what the member views are relative to what the office views are and actually inform that strategy creation. Now, the motion has already been presented, so should we, as Assa, actively participate in broad public policy analysis? Simon will be the person proposing this motion, and LUSANI will be against it. Sorry. Oh, terrible. Yeah, okay. LUSANI will be the person proposing this motion, LUSANI will be against it. Quick intro. So LUSANI is a health and public interest actuary, independent non-executive director and lecturer. He's worked as a CEO of a healthcare administrator and managed care organization and a healthcare actuary of a large healthcare administrator. He's an independent non-executive director for a couple of private insurance companies and does public interest work for Assa. In 2020, he joined the University of Cape Town as lecturer and is currently head of the actuarial section. In addition to his professional work, LUSANI has been involved in leadership structures of several community development organizations, and he was the president of Assa in 2020 to 2021. Simon has over 28 years of work experience, primarily in life insurance in South Africa. In 2020, he started part-time lecturing at Stellenbosch University and is currently consulting part-time as the head of an actuarial function or head of actuarial function. Prior to moving to Stellenbosch, Simon worked for Sanlam in Johannesburg. He received a Master of Arts in Applied Ethics from WITS in 2019, and this resulted in his paper on the actuary's duty to the public interest presented at the 2019 IA Colloquium in Cape Town. And in 2023, he co-authored a prize-winning paper with LUSANI for the 2023 ICA on the topic of Assa's public interest actuary. Simon has volunteered for Assa and continues to do so in various ways, notably chairing a subcommittee that rewrote APN 106 on the head of the actuarial function, and he presents on ethics in the associate professionalism course. Myself, quick intro, I've got 17 years of work experience in life and short-term insurance and 1.5 years in the wider fields as head of Property 24 at NASPAS. I've been volunteering for Assa for most of the last 18 years, first on council and now as chair of the education board. I have a keen interest in this topic, public interest topic, and so, as I said, I'm extremely privileged to be here. How this debate is going to proceed. So LUSANI is first going to do his opening speech, followed by Simon. Then LUSANI is going to produce his main arguments, followed by Simon. Then we're going to open to the floor. We're going to have about 10 minutes to please get questions and comments. So it's meant to be a discussion. Those questions, if you have any, will be addressed not one-on-one, but by the speakers as they deliver their closing arguments, which will be after the Q&A session. And then I'll do the final adjudication and a little bit of a closing. I'll be waving a little sign at the speakers. When their time is running out, we will manage this as tightly as possible. I've also been asked to say the official line is that the winner is actually the debate itself. And audience engagement and things like that. But actually, I'll of course make sure there is a winner declared at the end of it. So very much looking forward to your engagement. With that, hand over to LUSANI. Thank you.
I hope not to take too much time. I was trying to think of how should I ease my nerves? What should I say? What joke should I make so that I can relax a little bit? I'm normally not very nervous, but this being a debate, it's not a kind of format that we are accustomed to using as the Actuarial Society of South Africa. So I'm quite nervous to see how that's going to go. I don't think we should be involved in public policy for the sake of it. When I was asked by somebody at the conference in the United States where I was presenting on public policy, they said, but what should we do? And what I said, well, you don't deserve to be in the room. Say, why don't they bring us into the room? I say, you don't deserve. There's nothing about you being an actuary that says, I need to be in the room. There's a lot of work that you would need to do to be in the room. So it's not about us deserving to be there. That's not the reason. It's also not because we are smart. That's not the reason why we should be involved in public policy debates. There are a lot of PhD holders in many parts of the world that do the kind of thing that we are trained to do, the kind of thing that we can do in public policy. They do it rather very well. Most often, when one is doing research on any particular public policy issue, the kind of papers that you will find are done by doctors, academics, all over the world. And so it's not to say that that actuaries are the ones that have to be involved in this. So those are not the reasons. It's not to lobby for particular positions. One doesn't get involved in public policy from our perspective, from the platform that we're using as a professional body in order to lobby for a particular position. That's not the reason why one should get involved in public policy. So if those are the points that my learned colleague here was going to debate, I'm already coming up front to say those shouldn't be the reason why one gets involved into public policy into public policy debate. Now, what are the reasons why one should get involved, why we should get involved as actuaries, as the Actuarial Society of South Africa? It's because of the context we're in South Africa. I spoke to somebody a while back who said that there's a lot of data on education in terms of basic and higher education and so on, but very little of it gets analyzed by anybody. So it's not getting, it doesn't feed into the planning process as much as it should. So when you have a profession that attracts the cream of the crop, the top people, and that profession is only dedicated to one industry, that will lead to an imbalance. We will then find ourselves complaining. So the financial services industry in South Africa ranks amongst the best in the world. But when you look at education and look at education outcomes, ranks at the bottom. How can you reconcile that when the majority of South Africans are involved in education? All have to come through an education system. That becomes an argument why we should consider getting, unless if we think we are not skilled enough. On one hand, we may not be on the one we are, given the rigor that we have to go through to be where we are. In the area where I say that we may not be is in the area of the qualitative aspect that is required in this process. There are certain things that we may not be aware of that we need to know. We need to upskill ourselves in that. Then the interest from government itself. I get approached a lot, the Actuarial Society of South Africa gets approached a lot for comments, for participation in various fora that government puts together, even beyond the financial services industry. So there's clearly an interest from the clients, those that are representing public interests out there, to say we need the kind of rigor that comes with your involvement. So those are the reasons why we do. And then our own vision talks about us being authoritative in providing advice and thought leadership. How do you do that when you avoid the big problems that face us as a country, the big challenges that face us as a country? And you cannot just wake up the day you qualify as an actuary and go and enter those debates. But can you justify sitting on the side and watching things go wrong and not getting involved in all, and not even getting involved in the debate? So those are some of the reasons why I think we should get involved. But I will listen to my learned friend and I will do a comeback. Thank you.
Your notes. Right. Good morning, all, and thank you very much for joining us. I'd like to start with some thanks. First, to my employer, Stellenbosch University, for giving me the space to research this and for covering my attendance costs. While the university holds the copyright to my research, the views I express are my own. Second, to Nalen, for so enthusiastically accepting the role of chair at such short notice. Third, to Colin Fitzgerald at University College of Dublin and my colleagues at Stellenbosch University for comments on my draft. And finally, but most importantly, to LUSANI, the man himself. LUSANI and I have interacted on this subject for many years now, and I have greatly benefited from his insights and challenges. Thank you. But he hasn't won me over yet. I read somewhere that actuaries should become better storytellers. LUSANI is a consummate storyteller. Me, not so much. But here's my little story. I have been curious about the topic of professions in the public interest for some time. It seems to be ingrained in the actuarial psyche. Why is this so? And what does it mean? This spurred me to research the topic of individual actuaries and their duty to the public interest for my master's thesis. I then researched the topic of Assa's public interest actuary along with LUSANI. I now turn my attention to the role of Assa itself. Since LUSANI is presenting the case for the motion, my views are entirely on the opposing side. I recognize that my views may be in the minority, but I present them strongly in the spirit of debate, as I feel that this is a topic worthy of debate. In 2000, C.S. Bellis presented to the Institute of Actuaries on Professions in Society. She had this to say, quote, "The belief that one serves the public interest is agreeable in its own right, as well as being useful when it comes to lobbying for a monopoly. It is thus an area where some skepticism and self-examination should be exercised." End quote. Bellis alludes to possible self-interest motive in doing public interest work and urges for skepticism and self-examination in this regard. That is my role here today. I want to be clear that this is about Assa as an organization, an entity with its own agency. It is a debate for another day about the nature and possibility of such agency, but let's assume for the sake of argument that it exists and it is uncontroversial. This is not about individual actuaries. I'm not opposed to voluntary public interest work and related research by individuals and firms. I'm not opposed to Assa spending money on research in general, but we need to have an open debate about the nature of this research. Does it benefit all the practice areas, for example? A key word in the motion is broad, which means going beyond the traditional areas of actuarial expertise or beyond the financial services sector. I'm not arguing against involvement in the traditional areas of work, although this is not without risk. In what follows, I will argue against Assa taking an active role in broad public policy analysis and debate. My key points are as follows. Public interest is extremely tricky to define, and so success in this arena is not measurable. The possible reasons for undertaking this work can be opposed, or the aims achieved in easier ways. This work is not explicitly permitted by Assa's constitution. Resources are scarce, and decisions as to what areas to focus on are open to disagreement. It gives rise to significant risks, such as reputational damage. Thank you.
You cheated, Sanlam. You didn't take too long. I was expecting you to take a bit long. I was still taking notes. And just in terms of the main arguments of this, and thank you for the points that have been raised. So the public interest strategy 2021 to 2024 says that there is a need to be involved, not just within the financial services industry as mentioned. And you can understand that even the financial services industry is quite broad. And actuaries have not been involved in all aspects of the financial services industry. So it's quite a broad area. And the reality is that a lot of these aspects are interlinked. Let's talk about social security for a moment. Is social security fully within the financial services industry? One, ask yourself that. When you start to unpack at different levels, going from the low income side, the grant system, going all the way to pensions, you'll see that there are aspects that are fully well covered within the financial services industry, and there are aspects that are not, but there is a relationship across the board. So when you want to be involved in a debate that is dealing with social security, how do you, as a professional, as an actuary, get involved in that debate? Do you get involved in it in a way where, in a siloed manner, where you only deal with what you know? You deal with the pensions that you normally deal with your your employer? Or do you seek to understand the landscape? Do you seek to understand how are different population groups in South Africa faring? How many people are on social grants? How sustainable is that? And how do decision makers make those decisions? Is there a need for population projections to understand that? Are there implications if the economy all of a sudden is not doing well interests, inflation, all of that. Would it be important for one to understand those aspects? So the moment you start thinking like that, you can see that if you were to contain yourself and say, I will only deal with matters that arise within the financial services industry, you would not be able to contribute fully in that debate. And if you're not going to contribute fully in that debate, should you be in that debate? Do remember that I acknowledge that if you're not going to be adding value, you should not. Because yes, then it's risky. If you're not going to be investigating the question thoroughly and comprehensively, you shouldn't, because then yes, there is a risk to it. But the moment you're going to have a voice, and you want to have a voice in the public space, you would need to understand the space. You would need to understand the other things that link to it as well. You would need to understand the population groups in South Africa. You would need to understand the people that don't have access to the financial services industry. And it may well be that if we are able to solve some of the problems, and we don't have to be involved in every aspect of the problem, we simply need to understand it. We have what we call the actuarial control cycle. It talks about should define a problem, understand that, develop a solution, and then monitor the results. But you don't do that in isolation. You have to understand the general economic environment. You have to understand your professionalism responsibilities. You have to understand legislation. You have to understand the lay of the land. Only then there's hope that the solutions that you're going to put forward may be sound. As a professional, our responsibility is not to make sure that what we say gets done. Our responsibility is to advise. Our responsibility is to put solutions on the table. So therefore, it is possible that you may have one set of actuaries putting forward a different set of solutions than another set of actuaries. That should be perfectly acceptable. Because of the nature of the assumptions we make, the models we use, we know those are never the same, but still helpful. So our aim is to be helpful in public policy debates, not to bully, not to be the only, not to have the hegemony. No, that's not what we seek as professionals. Ours is an approach that is professional, that talks about there should be rigor in analysis. In analyzing the costs and benefits and the risks, there should be rigor. I think our training lends itself to that. There should be a very good understanding of the stakeholders involved. My view is that legislation, regulations, that is a product design situation on steroids. Because through legislation, you can have organizations that are created, new organizations from the ground, not just a product that needs to be sold through a broker, however difficult that is. Here you're talking about unintended consequences on steroids. Why would those that proud themselves as being risk managers not want to be involved in that? And yes, my learned colleague says, as an individual, you may get involved in that. He says that. But as an organization, you shouldn't get involved because there are many other priorities that we're looking after, therefore you shouldn't. And then, when there are complaints against that member, who then adjudicates? Who would be in a better position then to understand? But if there's an investment in understanding certain aspects progressively, and funding does not only have, to give you an example, when we investigated the supply and demand of electricity, we gave the research project to two different sets of actuaries, said, don't contact each other while you're busy with us. We'll be keen to see what comes out of that. That should be the approach. Let's have an ecosystem of knowledge. Let's contribute towards that. How do we then select the topics we get involved in? It may be the burning issues. Electricity was clearly a burning issue in South Africa. Load shedding was a burning issue. Unemployment is a burning issue. It affects us. It affects the very same financial services industry that we seek to protect. If unemployment doesn't go up, if the middle class shrinks, you're going to sell less policies. You're going to be out of work. So there must be a way, and there is, to prioritize and say these are key issues. Medical negligence. Those are some of the aspects that we have looked at on the space. We've sponsored that kind of research. But also, our strategy says co-creation, working with government agencies, commissions, task team in dealing with problems. You get invited to some of those things, and then you decide whether you have the capacity, you can participate in some of that. That is one area, co-creation. And the other is just saying thematic, saying we can talk about these are some areas that are needing answers, and individual lecturers can get involved in that. So in that way, you sort of direct, in a way, or influence what research can get done. And then you get involved in professional development like this. This is an aspect of professional development, you being aware of what's out there and what you can get involved in. Even having consulting businesses that will focus on certain areas as well. It's part of the public interest strategy. So there are many ways to achieve, and most of them include what my Leonard colleague is saying. They include that, they don't exclude them. But it is important to be in a position where one can be responsive to the interests, to the requests to be involved. I currently serve on the task team looking at student funding. That's a broader area. That's outside of the financial service. It does overlap with the financial services industry. What happens there impacts what happens in the financial services industry now and in future. So should one say no? As actuaries, we don't get involved in that. I'm sorry. The remuneration of public office bearers. No, we don't get involved in that. I'm sorry. Road accident fund. No, we don't get involved in that. I'm sorry. We're only trained to deal with pensions, life insurance, investments, short-term insurance, health insurance, and until, since recently. Maybe climate change. Where do we draw the line? Thank you.
Thank you very much. That's interesting. I will try and address some of those points as I go along, but also at the end, some great sound bites there. This is the long part now. So please bear with me. I have quite a few points, but I feel they're all important, but I might cut some out in the interest of time. So my arguments can be grouped under the following questions. What is the public interest? Why get involved? What are the resource issues and what are the risks? First, what is the public interest? I will get to it next, but a primary motivation for this public policy work is because it is deemed to be in the public interest. However, public interest is extremely tricky to define. As LOUW et al. Put it, quote, even with the benefit of hindsight, it is difficult, if not impossible, to identify what behavior is in the public interest in any particular circumstance, end quote. One implication of this is that we cannot measure success. If we cannot measure success, then how do we know we're doing a good job? Yes, there can be certain measurable outcomes, such as the number of meetings held or reports produced, but those tell us nothing about whether the public interest has indeed been satisfied. Furthermore, as LOUW and MULAUDZI say, quote, working in the public policy arena can be a long, drawn-out process that can take many years, or decades in some cases, end quote. In other words, even if we could determine a measure of success, it may just take too long. Second, why get involved? Perhaps the primary motivation for undertaking this work is that Assa has an ethical responsibility towards the public interest, so the argument goes. The rationale is that actuaries possess unique insights and expertise that can significantly contribute to public policy decisions for the benefit of broader society. It could be said that this motivation is stronger in the South African context, yes, although so-called wicked problems abound around the globe. Opposing this, I do not dispute actuaries' expertise in certain matters. I dispute their expertise in broad public policies. I will pick up on this point about competence later. For now, I say there are alternative ways for Assa to fulfill its public interest responsibility, such as by providing expert testimony or contributing to policy research in the domains in which it is an expert, rather than in broader matters. A further motivation for doing this work is that it can enhance the influence and public perception of Assa. By actively participating in public discussions, Assa can raise awareness about the value and expertise that actuaries bring to various policy areas. This engagement can help shape public opinion, contribute to evidence-based policymaking, and establish the actuarial profession as a trusted and relevant voice in public discourse. I agree that the public relations exercise is worthy. I disagree that this is the right way to do it, owing to the reputational risks that it brings, which I will get to later. Furthermore, Assa's objectivity may be questioned, or its viewpoints may be perceived as self-serving. Instead, there are alternative methods to enhance public perception and influence, such as engaging in targeted outreach programs, collaborating with other professional organizations, or providing educational resources to policymakers without increasing reputational risk. Another motivation for public policy work is that it can provide actuaries with valuable learning opportunities and enhance professional development. Actuarial professionals who actively participate in policy discussions gain a broader understanding of the complex socioeconomic factors that impact their work, as LUSANI said. By interacting with diverse stakeholders, they can refine their critical thinking, communication, and problem-solving skills, which ultimately strengthens the actuarial profession. I fully support continuing professional development and lifelong learning. I support individual actuaries seeking out such work voluntarily. I do not support Assa in this regard because, at a simple level, Assa cannot learn like this. It is an organization, not a person. Yes, the individuals involved may learn and benefit, but this does not transfer to Assa. Furthermore, there are less difficult and less problematic ways for individuals to get such development opportunities. In summary, while the motivations may have noble aims, the difficulties and risks outweigh the benefits and can be achieved in other ways that do not increase the risks. I turn to my next point. There is no explicit provision in the Assa Constitution relating to engaging in broad-ranging public debate. Instead, the Constitution includes the following in the objects of Assa. Quote, to consider the actuarial aspects of legislation existing and proposed, and to take such action as considered desirable, end quote. Note, this is a limited reference to actuarial aspects only. Furthermore, neither the Constitution nor the bylaws give Council explicit powers in this regard, save for a general, quote, do all other things which it is required or permitted to do or which are necessary in pursuit of the objectives and for the good management of the society, end quote. Note this is society with a capital S, meaning Assa rather than the public. However, this generality is limited by the objects of Assa as listed in its constitution. As I just noted, there is no object in of Assa explicitly dealing with broad public policy analysis and debate. A strict reading, then, is that Assa is not permitted to do this work. Assa's mandate to do the work is still questionable under a less strict reading. One might counter this by referring to Assa's Code of Conduct, which includes a paragraph explaining how the society, rather than members, deems its duty to the public to be met. This states the duty is met by actuarial education and CPD, developing and enforcing standards, engaging with regulators and in public debate. I draw your attention to the first two, being Assa's core responsibilities in my view. The last of these could permit Assa to venture into public policy. However, this is a defect in the code, as the code is meant to guide the conduct of individual members rather than the society. The society's conduct is directed by its constitution and bylaws. As identified above, there's no specific provision in the Constitution or bylaws that refers to this broad public policy work. Moving to my third area, what are the resource issues? Assa has limited resources. Engaging in broad public policy work could require a significant allocation of these resources in order for the work to be meaningful. However, increasing resources on this broad public policy work means less resources on Assa's core responsibilities. By instead focusing on its core responsibilities, Assa can allocate its resources to areas such as conducting relevant research, providing professional development opportunities, and enhancing their profession's overall standards and profile. This can have a more substantial and direct impact on the actuarial community and thereby the public. Contrary to this, suppose that some limited resources are indeed available. The question then turns where to get involved. There are numerous possibilities. How does Assa choose? Assa's public interest strategy, as LUSANI's mentioned, for 2021 to 2024, identifies the following thematic areas of involvement. State liability management, such as RAF or medical negligence, state planning capability, state entities' operational management, such as ESCOM and municipalities, and volunteerism and innovation, such as education and job creation. So far, outside of the more traditional areas, Assa's involvement has been somewhat limited to medical malpractice, non-communicable diseases, and job creation. The electricity one is a new one, so I'm looking forward to seeing that. But other than those two, job creation and electricity, are these really the most pressing issues in our country today? On job creation, I will make the point later, but this is not our area of expertise. Surely economists are better placed here. One may counter that economists can be consulted. Similarly, much broad public policy work requires non-actuarial specialist skills, such as those of lawyers, doctors, economists, engineers, and so on. However, this circles back to the limitation of resources. Assa simply cannot afford this. Furthermore, Assa's resources come largely from members' fees, and thus Assa is accountable to its members for its spending. Do you know where your money goes? Do you agree with this? Does it benefit you as a member? This reiterates my point that this public work is not Assa's core responsibility. The primary focus of Assa should be serving its members and advancing the actuarial profession. Broad public policy work diverts Assa's scarce resources into work that is of little value to members. Lastly, what are the risks? This work brings several risks, key of which is reputational. As Holloway, a marketer, identifies, quote, policy issues become explosive at times, and we find ourselves dealing with delicate matters in unfamiliar problem settings, end quote. The controversy around different viewpoints on government's response to COVID-19 is a case in point, where some feel this was poorly handled by Assa. This is not a comment on anyone's conduct. Rather, it highlights how fraught this arena can be. Engaging in this work also exposes Assa to potential biases and conflicts of interest. Actuaries are trained to provide objective and data-driven analysis. However, involvement in policy debates might compromise this impartiality, as they may be perceived as advocating for their own interests or those of specific stakeholders. Maintaining independence and avoiding conflicts of interest are crucial to preserving the credibility and integrity of the profession. However, this stance is very challenging to maintain, and more importantly, to be seen to maintain in such policy work. I mentioned expertise several times. This question of competence is a serious one. We are not wholly competent to do all of the work. While acknowledging such a risk in a general setting, as actuaries venture into non-traditional areas, LOUW and MULAUDZI state that, quote, it could be said that these risks are heightened in the public policy arena due to the multiple stakeholders involved and the inherently political environment, end quote. One way to mitigate this is to consult other specialists or to work alongside them. However, As stated above, this is limited by the resources available and whether this is indeed in the best interests of the members of Assa. The COVID-19 example starkly highlights how such work can lead to the politicization of Assa despite its intentions and lead to polarization among members. This can be avoided by Assa not engaging in such broad public policy work. One may counter the above by applying risk mitigation, as we do, such as can be achieved through appropriate guidelines and standards. However, as it currently stands, there is no clear, detailed, and published policy around this work by Assa, and there are no applicable standards to guide conduct in this work. This lack of guidelines and standards further heightens the risks involved. And finally, what if it goes wrong in some general sense? There is no way to discipline Assa, the organization, which is contrary to one of the characteristics of a profession, namely self-regulation. In conclusion, my key arguments are: broad public policy work is very challenging. It is hard to tell if the public interest is being met, if at all, and it gives rise to significant risks, such as reputational damage. Such work requires resources and expertise which Assa may not possess. This work is not explicitly permitted by the Assa's constitution and is not Assa's core responsibility. Thank you.
Thank you, Simon and LUSANI. It was brilliant. We are pressed for time, so we're going to shorten our Q&A session to about 5 minutes, if that's okay. Our team at the desk will handle any virtual questions coming in, and there'll be some roving mics on the floor. So let's open up the comments and Q&A session.
Thank you very much for a very insightful debate. My question is simple. If the debaters were the ones to decide if Assa were to participate meaningfully in public policy, we might not come to a conclusion if there are totally opposing views. Is there a middle ground that you've discussed, whether personally amongst yourselves, that we can pursue? Because clearly there's a significant number of actuaries who do feel quite strongly about meaningfully working in this public space.
Thanks. And our speakers will take all the questions and address them in their closing arguments as we continue. Question at the back.
Yeah. Right. So my question, I think, is to Simon to say, doesn't he see perhaps the issue of reputational risk being ring-fenced by an initial process for any research financed by Assa in public policy, undergoing some form of ethics screening? In other words, Assa would only perhaps allow such type of results, that would have passed the ethics policy, if ever it can be formulated.
Thanks, Prof.
Hi. So ultimately, this work will be published in the public domain, and someone has to be accountable for it. And so I'm trying to understand, so who is ultimately accountable? Is it council? Is it the exec? Or is it the underlying actuaries who produce the work? I think we need to clarify that.
Nick Hudson. I'd like to propose a middle ground and hear from the speakers on what they think about it, because I'm such a middle ground kind of guy. Can we accept the proposition that actuaries have something to contribute to the public interest, and perhaps that the best way for that to be realized is by making the space available for debate among actuaries on public interest issues, rather than the formation of policy as an organization? Would that not square the circle that we're sitting in front of today?
Thank you.
From our participants online, both who decided to be anonymous. Simon raises valid points. Could a compromise be for Assa to take this as a wider field in which some members work in? Then it will be up to those members to be involved and not on behalf of Assa. And then a second point, not all actuaries are suitably qualified to comment on public matters and may still choose to do so. How do we manage the risk that such individual actuaries may damage the reputation of Assa and therefore the actuarial profession in general in South Africa? I will also ask, in terms of what LUSANI spoke about, the context that we live in. And the question or the point would be, when has South Africa not been in some form of crisis? And so the industry should participate, but until when?
Thank you. Virtual questions. Any further from the floor? Two here. On the front. So we've got 1 minute. I apologize if I cut off any further questions.
Thank you. Well, to both speakers, I congratulate you on your points, but to LUSANI, I say well said. So, in terms of the contribution and reputational risk, I think it's my question would be, how do we become a trusted and relevant voice, contributing in a sort of multidisciplinary way rather than in a definitive way? If we step away for fear of reputational risk, we certainly, how do we hold each other to account to make sure that that we are contributing in the public interest, which, as you say, is difficult to define, and yet something that we actually all know what it is. And as we live in the context of the most unequal society in the world, isn't this absolutely critical? And what I guess the interest in this room demonstrates is what the members actually want the society to be doing, and therefore for the resources to be allocated in support of, but on the basis that there is some holding to account to make sure that our contributions are humbly done and done in the public interest for the greater good.
Thanks, Roseanne. I apologize to the other two questions. We have run out of time, so we'll pick it up afterwards. So, yes, so we're now moving to closing arguments, probably 3 to 4 minutes each, if that's okay. So, over to you.
I was trying to buy time so I can think a little bit more. Response. Very interesting debate, very interesting questions asked. The public interest strategy, which is coming up for renewal. Initially, one wanted to demonstrate how we could add value. And one was quite mindful of the risks, the reputational risks, resources issue, and so on. There was a budget that was dedicated upfront to support the kind of research in this space. And through the research work, we wanted to demonstrate the kind of value actuaries can add in that. And that research process was not one that was only done by actuaries. It's research that needed to be done together with multidisciplinary. So multidisciplinary, that's why the strategy talks to co-creation, to work with others in that. So there was an acknowledgement of the kind of points that have been raised. In terms of ethics clearance, yes. We don't yet have something to facilitate that within us. That is something that can be done. If we are going to be surveying people, which we haven't done much. There have been some interviews then there of and stakeholders. One would have to define exactly how that looks like, but yes, it's something that should be done. We should be accountable. We say that the researchers are accountable for what they do and what they produce, even would have statements in there to that effect. We do disseminate, for either it's for public interest seminars and so on, disseminate the work that is being done with that understanding. to stimulate the debate. To make the space available is exactly what the second pillar of the public interest strategy talks to, the thematic approach of saying these are the issues, spay it on, and you go and work it out and come and present to us. Even in this convention, I think even at this time, there's a topic on public-private partnership. It is a public interest type or public policy type discussion, but it was done independently by the researchers without our involvement. There will be one on load shedding as well. I gave some input at the end of that, but it's something that is being individually carried out by an individual member of the society. So that is a key pillar of the public interest strategy. So, and one can foresee that as time goes on, you will have so many of those things happening that there's no longer a need actually to, there may not be a need for us to actually fund certain, how can I put it, to lead certain research projects and so on. It may just be things that are coming up naturally from the membership. And one of the things that I wanted to see, you speak about measuring the impact. Now that could be rather pessimistic to adopt a view that we don't see impact and therefore there is no impact. When you do have commissions that are deliberating on complex matters and you give an input there, based on what the expertise you have and the consultation you've done with other experts, you give input there, and that input is used and facilitates conclusions or getting to a point by the commission and the work that is being done there. I think that's as far as it goes in terms of how we can measure ourselves. We then hope that as it goes through the political process, that you would end up with a kind of legislation or rules or regulations that are helpful in dealing with some of the issues that we face as a country. So that's what you hope for. It then goes to the definition of actuarial science. What is actuarial science? Is actuarial science insurance? Maybe it is. But perhaps there are aspects around the definition of insurance that lend itself to what actuarial science is. Trowbridge, in what he wrote in the 80s, I think, he said, actuarial science is the transfer of economic risk, the assessment of that, the understanding of that. Now, if you take that to a wider context, do you still have actuarial science? I'll leave that question with you.
Thank you very much. I see your strategy. Leave me no time. No, we need a couple of minutes for closing. Thank you everyone for your participation, and sorry we couldn't get to everyone. I'm sure everyone has an opinion, a voice on this, so it's great to hear. I'm not Dr. Evil. I do not dispute the multitude of problems that we face as a society. I do not dispute our individual desire to get involved and to work. What I'm trying to do here is focus on something called Assa. Not actuaries. You talk about we, Razan. Who is we? So I'm trying to separate out the organization which has specific responsibilities that we pay for, specific duties and things that it must fulfill that come from members' fees. I'm not talking about the collective of individuals. And I do agree that the collective can and should contribute in ways that they see fit voluntarily, with their own risk mitigation strategies in place, paid for by themselves or their firms. That is what I'm trying to argue. If we look at it at Assa, then the question does turn to who is accountable. It becomes very difficult. We cannot hold Assa accountable. How do we do that? Unless we figure out a way to do that. Whereas if individuals do it and they make a mistake and they create some reputational damage, well, then that's easy. There's the disciplinary procedure and the disciplinary committee that can deal with that. So that's sorted. There's no problem if an individual causes damage to the reputation. We have a procedure for that. If Assa causes damage to the reputation of the profession, what can we do? At present, there is no remedy. I think in terms of screening, there is a governance committee that does look at these things, but we need to see who is on that committee. Is there some independent and impartial people there who can perhaps provide a different viewpoint? Or is it all just yes people, people of the same thinking? And then there's questions about until when do we stop this? I think that was from online. That was a thought experiment I had for myself. Say we lived in, I don't know, Norway, or some very, very well-run, easy, highly funded, equal society, some utopia. Would there be a need then? Why would we still want to do public interest? Well, maybe not. I mean, there may not then be a need. And that's my point, is that you can divorce the society, Assa, from the problem. And then ultimately, yes, it does maybe come down to where is this line drawn? What is actuarial science? I think those are valid questions. What I'm trying to say is, what is Assa's role precisely? Thank you.
Brilliant. Thank you to our speakers. Absolutely fantastic and fascinating conversation. There was an online poll, if anybody filled it in. I don't know whether our people on the stage are able to see what the results are. Nope?
No.
Great. Okay.
No one.
That's perfect. So I then get to be the final decider. Look, I think we've got 2 minutes left, and I'm going to attempt to summarize what we heard today. I think we've all, in the comments coming through and in the comments from the two gentlemen on the stage, is that there are wicked problems that exist out there. There are complex problems that exist in society. And how do we as a profession look at them, and how do we solve them? Now, the positive that's come out of all of this for me, sitting here listening, is the amount of middle ground, compromise, wording that has come out of these comments and questions. We are looking for that ground where we can find each other. I think we have learned that we have to clarify as a society exactly what we mean by broad and where we want to get involved. To help prioritize our scarce resources, we have to work out exactly how we want to do this. So evidence-based analysis, which is core to our profession. We have to ensure within our constitution and code of conduct, as well as the standards that we have in place to govern this type of work, that we clarify where accountability lies between Assa and the members. Public-private partnerships, we already heard, are crucial. The engagement model that we use here and the measures of success, given that the long timeframes exist, are something we're going to have to work on. We're going to have to articulate. The broadening of knowledge across our landscape, do we do enough from an education perspective to give us a generalist backing to be able to engage with government? And to manage reputational risk, have we actually reached out to our profession, colleagues in other professions, doctors, economists, lawyers, engineers, etc., to broaden that contribution and help us better understand how to deal with all the stakeholders? I think the suggestion made is not all of this can be decided by one or two people in the office. Actually, it's member-led. And so debates on where we should get involved and how we should approach this are probably going to be part of our future. And there's a massive research opportunity here for people interested in the crowd. Lots of open questions that require some deep thought and analysis. So at the end of this debate, I think it is clear that we all agree that we should be involved in public policy analysis. So LUSANI's arguments are extremely strong. But what Simon has brought to the table is all the factors that we need to consider as we enter this realm. And so I wish our public interest actuary and all the people interested in this all the best as we take our strategy to the next level for the next 4 years. Thank you, everyone.